Well, hello everyone. This is Dr. Amigues, your friendly rheumatologist, here for another live in rheumatology. And today we're going to we're going to respond to a question by Nora, who's asking what type of exercise we can do when we have rheumatoid arthritis. But I'm going to extend this to also the question of psoriatic arthritis, ankylosing spondylitis, and so on. and that's a really, really good question because, as you all know, I talk a lot about the fact that when we have a rheumatologic condition, we want to make sure that we are doing things that are decreasing the inflammation. And one of the things that happens with exercise is that it can actually help our immune system. It actually causes a little bit of inflammation, but it's good inflammation. It really stimulates your immune system. It's kind of like, imagine exercising for the army. You need them to exercise on a regular basis so that they are fit. And that's the same thing. We want our immune system to be fit. And that's a good way of being fit, of making sure that we have energy to help our body. And the thing that happens, and that, that's really what's happening, is that when if we did develop rheumatoid arthritis, lupus, ankylosing spondylitis, psoriatic arthritis, gout, and so on, we have so much pain that we are stopped in our ability to exercise. Yet we know that it is important for us to exercise. And so that is a really, really important question, because what's the balance, right? In one hand, I have pain. And so really often the question is, do I exercise through this pain? And so, there is not one size fit all, but I'm going to give you example of different type of things that I would recommend to my patients. So if someone has a big flare of gout, I'm going to start with this one. So severe pain of your foot and so on, and it's really painful, and you can't really do much. The truth is that if I tell you go and exercise, you're going to be like, what are you talking about? This is the worst pace of my life. You will be right. And so in this case, I would say first thing, most important thing is for you to be fully controlled. If this is gout, we want to make sure that we take care of this inflammation. We make sure that we're taking care of all. And we can, and pretty fast, actually, right? Now, we take care of the gout, we take care of it. You don't have to worry, and then you're normal, so you don't worry about it. Now, if you have rheumatoid arthritis, and if you're coming with a flare, meaning that you are not yet in what we call disease remission or minimal disease activity, then I would say, because it takes a little bit more time to get you to full remission in rheumatoid arthritis than it would take for gout, then I would say I personally recommend that we do exercise. But the exercise that you want to do are those that do not cause any harm on your joints. So what I mean by that is that if you have a lot of inflammation, if you have swelling, and if you have 2 hours of morning stiffness, I don't think it's a great idea to put pressure on your joints. So yeah, I don't recommend running. Now, I do think that you potentially could rock climb, because that doesn't put so much, if you've been rock climbing for a long time, right? It doesn't put so much pressure on your joints. You definitely can swim, and you potentially could do some yoga, qigong, tai chi, as long as you're not pushing on the joints that are really painful, right? And so you see how we went from, I have a flare, I'm in rheumatoid arthritis, it's not perfectly in remission, but I'm going to adjust the joint, the exercise that I do, so that I can help my joint, so that my joints are not in severe pain, right? And so aqua gym is great. Anything in the water is phenomenal, because not only is it helping because it releases the weight of your own body, it actually has, the water by itself can have some effect, can actually help with arthritis. So unless you have some open wounds, I absolutely recommend anything with water. So that's highly recommended, right? And you can actually swim quite a bit, and it's not going to hurt you to swim. So that's a really good exercise for anyone. Like exercises and swimming, that's very good. Even just walking inside the water is not a bad thing either, right? And so, right, that's this. So that's for rheumatoid arthritis. If you have full remission of rheumatoid arthritis, we shouldn't be talking, because basically you can do whatever you want. There's zero restriction. If you are in full remission, there's no restriction on the amount of exercise that you can do. If you have a flare, if you're not yet in remission or minimal disease activity, then that's a different story. And yes, you want to adjust. And then we have patients who have spondylarthropathy, ankylosing spondylitis, so that's the inflammatory back pain. For those patients, I recommend in the morning to do at least 10 to 15 minutes of stretching exercise. So that can be yoga, that can be just stretching by itself. That will actually help you to be better. And it actually may allow you to not need more medication than you would normally if you don't do that at all. The truth is that the vast majority of patients know how much they can do by trying. So when I said at the beginning, it's not a one size fits all, I really mean it. You've got to try what works for you. So do you think that you want to do just swimming? Or maybe you're like, no, I actually hate swimming, so I don't want to do that. But maybe it's walking. Maybe it's walking a little faster. Maybe it's rock climbing. Maybe it's yoga. Try different of those exercise and see how your body is doing when you're doing it and after you're doing it. Give it at least 2 weeks or 3 weeks or even a month before you decide, because if you not exercise at all and suddenly you become someone that exercises, your body is not just adjust to it. So you're going to have muscle soreness, right? And that's totally normal. But yeah, when it comes to exercise, you do not want to put pressure. Like if we were to summarize, you do not want to put pressure if your joints are swollen, but you absolutely can exercise in water. So that's, a big one. And then as long as you don't have any open wounds or anything. And then the second is the goal always is full remission, so we can get you there. Okay. And then when it comes to osteoarthritis, which is the wear and tear, which is something that rheumatology is not as good at, my recommendation actually for that is to first lose weight while you try some exercise, so walking, but first lose weight, because then you'll feel better for exercising. It will be easier. And there is a study that just came out that showed that if you have knee osteoarthritis, GLP-1 agonists will help you not only lose weight, it will help you with the pain of osteoarthritis of the knee. So for me, if I have a patient that is obese or overweight and they have knee osteoarthritis, I absolutely recommend to do GLP-1 agonist to help with weight management, but most importantly, to take care of the osteoarthritis. There's no judgment there. Okay. All right. Well, if you have enjoyed this conversation, I would love for you guys to put a comment to tell us what you thought of it, and also share it with someone that you think may be interested in learning about this topic. I would love for you, if you don't mind, subscribe to the YouTube channel. So it's Rheumatology 101 by Dr. Amigues, Amigues. That will mean the word to me. We're trying to reach 1,000 subscribers, and we are 975 or 976. And I'm really excited to get to the 1,000 subscribers. So please go and subscribe. And if you're watching this after the live, #replay. And thank you so much for Chelsea, for Nicole, for Rock Dog. And then I will see you next week. Have a wonderful day. Oh, next week is just before Christmas, so maybe we will miss that one, but I'll see you very soon. Take care, everyone. Bye. Have a wonderful day and a week. And happy holidays if I don't see you before. Bye-bye, guys.